New Jersey, Congressman Jeff Van Drew. He's a member of the Homeland Security and Transportation and Infrastructure Committees. Congressman Van Drew, what do you make of this injunction? But also SCOTUS, I think it's on Friday, the Supreme Court is going to hear two cases that are fast-tracked about the mandates. One, importantly, the one for businesses that employ more than 100 people, and then the separate mandate for healthcare workers. Where does this go? Are these mandates struck down?
I think these mandates are struck down, and I think they should be struck down. Even what we're doing to our military is wrong. We literally take Navy SEALs who travel the world to the most dangerous situations, put their lives on the line. So they're certainly not afraid of anything. They simply have a strong personal, religious feeling or otherwise. You know, America is a place that's constitutional, and there's nowhere in the Constitution that says that, you know, there's an exception for vaccine mandates, or there's an exception even for the military, quite frankly. So I think it's struck down. And secondly, just on this entire process of what's happening with COVID and Omicron and the way that the CDC, the president, and Fauci are running this thing, Fauci should be fired. I've said it twice. I'll say it three times. I mean, you almost have to think that the people who were responsible for the policy in Afghanistan are now running the policy for COVID, because it is so fragmented. They don't even say the same things. The president says something different than Fauci. Fauci says something different than the CDC. God knows what the World Health Organization says. I mean, this is shameful for the American people.
Well, speaking of that, America's top health officials are split over whether a rapid test is needed after quarantine. Take a listen to this.
The PCR test after infection can be positive for up to 12 weeks. So that is not going to be helpful.
Why not test people at that time? I myself feel that that's a reasonable thing to do.
These comments are raising questions over whether officials are making decisions based on science or public opinion. Congressman, your reaction to this, because I can tell you, I've had COVID twice in 10 months. I got it in March before I was vaccinated. I got an antibody infusion. That didn't help, clearly. I got vaccinated. I got a booster, which wasn't soon enough, clearly, but I got COVID again. These are vaccinated people who are getting COVID and who are spreading COVID. And we got 1 million tests a day, and I think people have woken up to the fact that we've missed Christmas because of a bad cold. With the Omicron variant, it's a horrible cold, but it's clearly not the deadly, maybe it's because of the vaccines, but not the deadly pandemic we were talking about. It's time to get back to life.
Absolutely. It's time to move on to life. It's time to recognize that this vaccine is really not the vaccines that we're used to. By that, I mean, usually you get a vaccine for smallpox, for measles, whatever. You're protected, period. That's the end. With this vaccine, it wears off, it gets weaker, boosters are needed. This is really a therapeutic injection of a type. And I think we're going to learn a lot more. And by the way, we've been given so much misinformation. If you want to follow Fauci, first in the very beginning, you didn't need any masks, then one mask, then 2 masks. Then if you got the vaccine, you'd be A-OK. You wouldn't need masks again. Oh, but no, you do. And if you get the vaccine, you're not really protected completely. It reduces, I got the vaccine, it reduces, the severity of the symptoms and the danger, but still it's there. And I know plenty of people who got boosters in time that have gotten COVID again. So there's a lot more to this. They don't either understand it or they don't tell us the truth. And worst of all, just go to the rapid tests. The bottom line is we don't have enough of them. They had all this time to make sure. They knew this was coming up, but it's still a failed policy. Again, even if they have them tomorrow, people waiting on long lines. And the way these tests work, you can get a false positive. So don't say people can't go back to work or can't.
Or they also, for days and days and days, don't pick up the virus when it's an active contagious virus. They don't pick it up. These rapid tests don't. I'll just point to Joe Biden before we go. He hammered President Trump on the number of people who died in 2020 for COVID. More people died under Biden in 2021. And Biden had months and months, almost a full year, to get the testing straight. He didn't do it. The states got $1 trillion. Where are the states on getting people tested? Congressman Jeff Van Drew, thank you for being here.
Exactly. Thank you. Happy New Year.
Happy New Year.